Okay, this video is called Hypertension and Diabetes Conversation Number 2 with an internal medicine doctor, an internist. So, recently I got a phone call from an internal medicine doctor. This guy's known as being a great doctor, real smart, nice, honest, fair, cares about his patients. So anyways, he says to me, he says, Pete, sorry about the dogs. He says, Pete, is it difficult to become a vegan? I said, no, it's easy. The only thing you need to know is how to boil water for, oatmeal, rice, beans, potatoes, sweet potatoes, quinoa. It's easy. And he says to me, Pete, I've been treating hypertension and diabetes patients for over 20 years. And he says, I know that the standard of care guidelines, they don't work. He says, my hypertension patients are not doing that well. And when I give these diabetes medications to my diabetic patients, they just tend to get fatter and sicker. And I tell them, well, it's because it's a dietary disease. You're never going to treat it that well with a pill. Okay, once they're insulin dependent, they need insulin, but nice to help prevent them from reaching that point. And he says to me, one of my friends just prescribed one of those fancy new diabetic drugs to a patient, and the guy got pancreatitis. And the patient sued him after he got pancreatitis. And I said, well, have you ever read about the low-fat vegan diet? And he says to me, we never had any training in nutrition in med school or residency, but I'm realizing now that I need to learn about it. These drugs just aren't working that well. And I said to him, well, you should study the epidemiology of nutrition. That makes it obvious. In plant-based populations, people who don't add salt to their food, they almost never get any hypertension or diabetes, less than 1%. And that's for other really rare causes, okay? And so he says to me, I'm going to have to try that for myself. But, how do you convince a patient to go vegan? He says, I saw some doctor on the internet saying the keto diet was best for diabetes. What do you think of that? I tell him, no, it's stupid. High dietary fat causes insulin resistance. By depriving yourself of carbohydrates, you can transiently lower your blood glucose, but that's not sustainable long term, and you still have the problems of insulin resistance, okay? And in reality, you also still are going to be eating a diet likely with excessive dietary sodium, which also increases insulin resistance, deficient in potassium, deficient in fiber, and you're going to run into problems with your membrane ion pumps, not just for the sake of hypertension, but for all the other things that they do by being high in sodium, low in potassium. So he says to me, well, what do you do to motivate a patient? And I tell him, well, you know how it is. The patient has to want to learn. The patient has to be willing to change. Most people think in a social way, and social thinking doesn't work. Social thinking is things like, when in Rome, do as the Romans do, everything in moderation, variety is the spice of life. That's for screw-ups, okay? To think successfully about health and nutrition, you got to think like in a biblical way, like the 10 Commandments. And he's like, well, what do you mean by that? I said, well, it's like a smoker. You don't tell him you can smoke a little bit. You tell him no cigarettes, no more cigarettes, not one for the rest of your life. You tell an alcoholic, no more alcohol, not one drop for the rest of your life. And to get the best results with health, for a health vegan with nutrition, they should be thinking that same way, like the 10 Commandments. Thou shalt not eat meat. Not one bite. Thou shalt not eat oil. Not one drop. That type of thinking gets great results. And if they're not willing to do that, they're probably not going to do so well. So most people aren't. Most people aren't willing to make a serious change in their diet. They simply don't understand what they're heading into. They're heading into a disaster and they don't realize it. So then he says to me, he says, Pete, you really should be giving nutrition and pathophysiology lectures about diabetes and hypertension to the internal medicine doctors. We don't know this stuff. And if you would, teach us more about this stuff, this would be really good for patient care. And I said to him, well, I'd be happy to, but you know what? People also got to realize it's not a quick fix. It's not a sprint. It's more like a marathon. It's learning how to be healthy. It's learning how to prevent diseases, how to minimize these diseases and be healthy as possible for the rest of your life. It takes a commitment, an ongoing desire to learn and to improve. And most people don't have that. But for the ones who do and the ones who want to, this information's available. A person can learn simply realizing that it's possible and then seeking the information. So anyways, that was interesting. Hope it's helpful.